Not in my words, not in that way, not in my name, not in my faith, not in my words, not in that way.
Welcome viewers to another edition of A Muslim's Perspective. Praise belongs to Allah. We praise Him and we ask Him for guidance and forgiveness. And we seek protection in Allah from the malice of our own souls and the evil of our actions. Whom Allah guides, no one can lead him astray, and whom He makes astray, no one can lead him back to the right path. I bear witness that there is no other deity but Allah, by Himself, no associate to Him, and I bear witness that Muhammad is His servant and His messenger. Today our discussion is based on mental health, and we are pleased to have our guest, Sister Rina Vanza. Assalamu alaikum.
Walaikum salam. Thank you for having me today.
You're welcome. And a bit of background, very brief, on Sister Rina. Sister Rina Vanza is a registered psychotherapist who is a co-founder and one of the directors of Cedarway Therapy, a center that provides psychotherapy and assessments for individuals, couples, and families. Cedarway Therapy has clinicians who are specialized in various mental health issues and can provide therapy in various languages. Rina works with individuals, couples, and groups with a focus on trauma, anxiety, grief, depression, parenting, and burnout. She has been in the mental health field for over 15 years, and Rina is also a national mental health lead at Nisa Homes, who was a guest in our program previously, a group of transitional homes across Canada that support women and children who are experiencing homelessness. Sister Rina.
Thank you for having me today. And just before we start, Brother Alim, I do want to have a little bit of a disclaimer saying that if anyone's listening who is under the treatment with their doctor or their mental health care provider, please do not adjust your treatment plan without speaking to your provider first. This information is strictly for educational purposes and is meant to increase our awareness of our mental health and how we as individuals and as a community can be supportive to those who need support. I also would like to make clear that I'm not a scholar of any kind in the religion, and so my responses today will be from a perspective of a Muslim professional in the mental health field.
Thank you very much. The terms mental health, stress, anxiety, depression, self-care, and other similar terms are commonly heard these days. The global population is diverse in terms of belief systems, ethnic origins, socioeconomic backgrounds, language, asylum seekers fleeing violence, nationalism, and much more. Many in our faith community hold negative views towards mental health, and it is a difficult topic to discuss, to say the least. The subject of mental illness itself is a taboo issue discussed both in the wider society as well as within the Muslim community. Usually it's in the shadows and in whispers. Wherever this issue is raised, misconceptions are bound to follow. If a person is diagnosed with a mental illness, some common misconceptions are that the individual are being disturbed by evil spirits, or that the individual is being punished by God for a sin that he or she has done. Some may also claim that the illness is a sign of weak faith. Beliefs about possession and stigmatization influence people's attitudes against mental health disorders. Mental health, particularly depression, is often not viewed in our faith community as a legitimate condition or concern. If you are sad, you should see your blessings and pray more and move on. These are just some of the misconceptions, and we hope today to address some of the basis of the field of mental health and how it plays into the whole definition of health, which we tend to only think in terms of physical health when we say our health is good. So, Sister Rina, why is mental health literacy important?
Yeah, very important question. And I think first it's important to define what mental health literacy means, right? And so mental health literacy really is a broad term and can be defined as our knowledge, our beliefs, and our abilities that allow us to recognize and manage our mental health well-being. And so mental health literacy helps us understand how to maintain positive mental health, so how to deal with emotions, how to deal with our thoughts and our behaviors. It helps us understand mental health disorders and their treatments. Mental health literacy also decreases stigma, as something you touched upon, around mental health, which are really the negative attitudes around something. And when we have mental health literacy, then we also increase our help-seeking behaviors. And so mental health literacy becomes important because without understanding what mental health is, we will continue to misunderstand it. We will not seek help for ourselves. We will not seek help for others, people that we love. And so ultimately what we do is that we start causing harm to ourselves, to our individuals and our families and our societies. Because when we don't take care of mental health, we can cause disruptions in an individual's life, in a family's life, because we disrupt family relationships, loss of income, all of these things which impact us and others that we love. So, in a nutshell, the mental health literacy is gaining the right type of knowledge that will allow us to become more responsible for ourselves and for others.
As a layperson, how would you say we should understand mental illness?
And so mental illness, also called mental health disorders, that's probably a term that you've heard as well, refers to this wide range of mental health conditions that affect your mood, your thinking, and your behavior. And so examples of mental illness can include things like depression, as you mentioned, anxiety disorders, schizophrenia, eating disorders, and there's a lot other terms and diagnoses that come under this umbrella. But mental health illnesses are really, they're caused by different factors. So there's a genetic component to it that would increase the likelihood of someone having a mental health disorder. Research also shows that there's environmental exposures before birth that can increase the likelihood. So things like toxins, drugs, alcohol. There's brain chemistry where we have certain chemicals in our brain which we need to function well. And if there's an imbalance in that, then we can be more prone to develop a mental health illness. And so when talking about mental health illness, I think it's very important to define, there's a genetic component and there's also environmental components. A lot of times in our community, people use the blame method where they blame somebody for being lazy or not doing enough or bringing this upon themselves. When we talk about mental health illness and understand it's something that's affected by both genes and by environment, that helps us shift that type of blame and shame talk that we have in the community. The other thing that I would like to emphasize is that there are certain risk factors that increase the likelihood of someone developing a mental health illness. So risk factors are things that make something more likely, right? So if you have a history of mental health in a blood relative, like a parent or a sibling, that could increase your chances. If you live in or have stressful life situations, and that's why today we're talking about how do we mitigate these things so that we can decrease the possibility of developing a mental health illness. So things such as, chronic financial problems or trauma that happens, maybe a death in the family or a traumatic experience, people that come from war zones or things like that. People with less healthy connections in the family, the community, someone with a chronic medical condition that's not seeking proper help. Use of alcohol or drugs, child abuse. There's so many factors that contribute to someone having a mental health illness. It's not just because it's the person, something's wrong with the person, that they would develop something that we would diagnose as a mental health illness.
Kind of going off script. Can parenting be the cause of mental illness and can it flow through generations?
Again, we have to be careful when we talk about causality, right? It's really a mixture, an amalgamation of all these different factors. So if you come from abusive households, that could trigger a mental health condition in life, yes. But there's also, we have to be careful of the blame, that because of the parenting, someone got a mental health illness. It is a combination of a lot of factors. Yeah.
And how, I mean, when we put it in the faith context, I mean, we have all practitioners to different degrees of Islam. Is it something which is recognized as a valid health issue?
You're asking me what the place of mental health is in the Islamic context,
That's right.
basically?
Yes.
Yeah. So, you know, to my understanding, and as I said earlier in the disclaimer, I'm not a scholar, but who's someone who practices the religion, I don't really see Islam as separate from mental health, right? Like if we define mental health as our cognition, so the way we think, the way we behave, the way we feel, then we can take from this that our religion encourages taking care of mental health, right? And so Islam, as we know, is all about our behavior, our actions towards ourselves, towards others. It's all about taking care of our emotions, of ourselves and our others. And so when we do all these things, we preserve our rights, the rights our body and our mind has over us, and we also preserve the rights that other people have over us. And so, you know, when I look at Islam, I think of a holistic religion, where we're taking care of body, mind, and soul, right? And so when we talk about these relationships, it's our relationship with ourselves, our relationship with others, our relationship with God, Allah subhanahu wa ta'ala. And so I don't see how we can separate mental health from the Islamic context. You know, Islam gives a lot of us that peace and that contentment to be good people and to practice good behaviors towards others and ourselves.
Adab and akhlaq.
That's it, right? And if you look at our religion and our basic spiritual practices, whether they're praying, adhkar, umrah, hajj, you know, pondering on the signs of Allah, all that is there to keep us in a good mental state so that we can then perform our roles and obligations towards ourselves, towards others, and towards God. So I personally don't see the separation. And you know, I would really like to direct your audience also towards Dr. Rania Awad's work and Dr. Human Kesha Wersi, who really delve into mental health within the Islamic context. They've got some really good work and some really good talks around this concept. And you know, just recently I was learning about how mental health care has been part of our religion from the very start. So if you look at their work, you'll see that the very first hospitals in psychiatry, you know, cognitive therapy, which is where we look at how our thoughts shape our feelings and behavior, they all stem back to our religion and very early practices. You know, if you look at our history, then mental health was part of our holistic care. It's part of the self, right? It's just in the modern era where we separate self through physical, mental, or emotional. Historically, Islam has encompassed all three components.
Comprehensively.
Yeah, absolutely. And so, you know, the short answer to that is I don't see the separation of Islam and then mental health. I just see it as part of our religion.
Yeah, only this morning I was seeing a short clip from Rana Ayub in which he was saying that there was a scholar in the 9th century.
Yes.
Abu Zaid al-Balkhi,
absolutely.
who wrote a book, Sustenance of Body and Soul.
Right.
And how his definitions map, like OCD,
Yes.
in exactly the same terms
Yes.
that it was first discovered
Right.
in Western
Right.
mental health treatment. I mean, it's almost 1,000 years
Yeah.
apart.
Exactly.
And got the history books rewrote
Right.
as a result
You're
of
right.
that.
And this is why I directed you towards that work, because even something that a lot of us therapists practice is cognitive behavior therapy. But it's traced back, and if you look at Balkhi's work, you'll see evidence of cognitive therapy in there. It's what we do in clinical settings now. So it's quite fascinating. And
It
so
is.
the separation, really, if you're well versed, it doesn't exist. Right?
Yeah, because I mean, even when they said, even when you recite Quran, it helps with inner healing.
Right.
And so, I mean, it's a beautiful, integrated, comprehensive view of the human being.
Right.
And to me, it's something that seeks to bring, we are people of the middle, people of balance.
Yeah, absolutely.
We are not people of extremes.
Right.
that is those who follow the essence of the faith.
That's it. And if you look at research, modern research now really shows that people who have strong faith and are using their faith as coping actually have better mental health outcomes. So if we look at, something we'll touch on a little bit later is hopelessness and suicidal thoughts. People that have hope in something have better outcomes than better hope. It's because of that hope, and what religion does for us is it gives us that hope. And now they're showing research that actually proves that.
Alhamdulillah. So you mentioned the word cope. So how do we cope with psychological distress?
Right. And I think the first thing and the first step, and we've been discussing that, is this whole the concepts around mental health literacy, right? Very important. If we don't know the basics towards, what are we feeling, naming our emotions, labeling them, learning how our body and mind reacts to stresses in life, we won't know what to do with it, right? And then when other people are also behaving in ways that are not normal to them, we won't know what to do with that either, right? So I think accepting that this exists, accepting a very simple premise that emotions exist, that mental health exists, is key, right? And so once we accept this, then we'll learn, we can't ignore warning signs, right? We can't just pretend things don't exist. So that acknowledgement is key in coping with psychological distress, because once you accept it, you acknowledge it, you learn about it, you know that you can do something about it, right? Psychological distress is something inevitable. We're promised it. We go through it as mothers, fathers, workers, volunteers, whatever our roles are, it's something we go through. And so we can take steps to deal with it, but my goal here is to let your viewers know is that you're not alone in dealing with it. Psychological stress becomes intolerable when we're alone, and then we can have a whole host of other outcomes that are not adaptive or good for us, right? So learning to recognize your warning signs, right? How does your body and mind react to stress? Are you irritated? Are you angry more often? Is your sleep and appetite disturbed? Getting your routine medical checkups with your doctor. If you have a good doctor, they can recognize when you're sort of not your norm, right? So routine medical care is important. Not waiting. People often think I can do it by myself. I just have to do this. I just have to pray more. I just have to. If you're recognizing and you know of these signs, then you can go seek the help that you need, right? So we can cope with psychological distress is if we go talk to somebody, right? And then taking good care of yourself, which are the basics. You want to interrupt?
Might I interject?
Yes.
Many of us are in relationships, as you determined, as you said, we have spouses, children. How are we to recognize that someone is undergoing psychological distress?
Right.
When we don't even recognize it as an issue.
Exactly.
Because so many of us grew up in a culture of authority, command, obey. And if you are showing signs of psychological distress, it might be interpreted as simply being disobedient,
Right.
or some other trait,
Yeah.
rather than embracing that moment and saying, what's going on?
That's it.
How do we recognize that?
Yeah, I think, shows like this, first of all, we'll talk about it a little bit later, right? Opening these forums to recognize that there's something there, like emotions are a real thing. We put so much importance on physical health, right? We have a headache, we go to the doctor. Our spouse has a headache for a week and we're like, maybe you should see a doctor. But our spouse is feeling low for a week and we're not saying maybe you should see a doctor, right? We're not wondering what's going on. And so I think having that level of curiosity, even when it comes to emotional and mental health, that people are allowed to have emotional and mental health issues just like they have physical health issues. And I think one of the most important things, Brother Alim, is to reflect on yourself too. If we don't give ourselves permission to feel and to take a break and to recognize these signs in ourselves, we're not going to do it for somebody else. Right? And then recognizing a comment that you made earlier about the generations, recognizing now there's a lot of information out there, right? We're doing a show that's going to be broadcasted. There's no lack of information. It's the lack of implementation.
Or sensitivity?
Right? And how do you do that? You educate yourself. You open yourself to these things and recognize that these things are real. Right.
Okay, so you've gone to the doctor and the doctor prescribes some medication. You go and you check Dr. Google and he says, you know, these have some serious side effects.
Yes.
I wouldn't take it today. I can manage my feelings.
Right.
I wouldn't take it today. I would manage my feelings. And then progressively your health deteriorates, your mental health.
Exactly.
You can lead a horse to water.
Right.
Can you make it drink?
You can't. And the same thing can be said for physical health as well, right? Like, again, it's the stigma we have around mental health. Like when someone has, you know, something like cancer, we don't say, oh, I'll just take my chemotherapy today, but I won't take it tomorrow, right? We want to get better. Yet mental health issues can be as debilitating as a physical health issue. We don't take physical health in our own hands, but we think we can with mental health because there's stigma around it. And so really reducing that stigma around it and normalizing the talk around it and normalizing struggle, I think is key to sort of to move away from this, you know, the old talk we had that came down through generations of suck it up, don't feel this, go pray. It's not normal to feel sad, right? Yeah.
Yeah, the struggle is real.
Struggle is real.
If someone has faith in God, they shouldn't be depressed or have mental illness, should they?
Right. Very, very important question, because as a Muslim professional, it's one of the first ones I get. Even when clients come, they say, you know, I pray 5 times, I do this, I shouldn't be depressed, right? How do we decide who should or should not have something, right? If we're going to equate physical health issues to mental health issues, because as you said, the struggle is real, then we don't decide who has cancer or diabetes, for instance. How can I decide if someone should have schizophrenia or depression or make a judgment on that, right? And so, as I indicated earlier, that mental health issues such as, you know, depression are a combined effort of our genes and our environment. So many people who have strong faith can also be diagnosed with a mental health issue despite their faith. We can use faith as a protective factor where, you know, it helps us cope by giving us hope and structure and community. And a lot of clients that come that want to use faith as part of their treatment plan, it's welcomed because, as I said earlier to you, that faith is one of the best coping mechanisms in combination with everything else. So should someone be depressed or not because they're practicing? I don't think we should be answering that. It's what's in front of us and what's real, and we should be working with that.
Yeah, because my understanding of depression particularly, it's not necessarily sadness, but it has something to do with chemicals being produced or not being produced in your brain, and you know, it's something that can be treated.
It's a host of factors, and in combination with good medical treatment, good psychotherapy, a lot of people can come out of it, a lot of people can maintain it, a lot of people, you know, have very good quality of life. But again, we have to recognize that this exists and this is what I have to do in order to get better.
Inshallah. Now, is consulting an imam or religious scholar enough to address someone's mental illnesses or personal challenges?
Right. So personally, I think using imams and scholars can be a great addition to one's mental health care. In fact, you know, hopefully I envision a world in which we have this holistic service in the Muslim community where we have an imam or scholar, a doctor, a psychotherapist, all working and collaborating in the circle of care of somebody, okay? But if one is using an imam, it is important to ensure that the imam is either trained in whatever condition they have, is trained in the field of psychotherapy, and if not, then they're working or they're open to working with their mental health care provider, so in collaboration. Okay? If a person has a mental health illness and they're only going to an imam for their struggles, I would say that that's something I would not recommend to only do. I think it should be integrative and part of their care.
It's good, but it's not sufficient in getting a very good outcome.
Absolutely. And you know, I do work in tandem with a few imams or religious leaders who clients are comfortable with. So let's say I have a client who has OCD and it's religious based, then as I said earlier, I'm not a scholar. So I will work with that imam to help that client for the best outcomes. And they will work with me to make sure that that person is doing, you know, ABC in order to fulfill the rights of their psychotherapy as well. So it's really a collaborative relationship. I don't think either or is the only answer.
Yeah, I think we should also recognize that we live in an era of specialties. The very few people who are polymath,
Right.
and have a, you know, all of the necessary skill set and knowledge and education in all fields
Right.
to be able to give you the best outcome in especially in fields like mental illness, or even we don't go to an imam when we have a broken arm.
Right. Exactly.
So we need to understand what we're dealing with, because as we say, the struggle is real. We'd like to take a break now from this discussion, and viewers, we will be back with you shortly. Hope you can join us.
Not in my faith, not in my words, not in that way.
Welcome back, viewers, and we are discussing mental health with a very astute and knowledgeable person here, Dr. Rina Vanza. We so appreciate her coming in for this interview and to educate all of us on mental health literacy. And I hope it can benefit you or your friends or your relatives. You know, please, you know, share the program with them, and let's see if we can improve our mental health awareness in our community. So, Sister Rina, often people find it difficult to approach the right specialist, as we were speaking before the break, to seek professional guidance. Can you briefly explain the roles of the following professions in the mental health field? You deal with psychiatrists, you deal with psychotherapists, you deal with psychologists, you deal with social workers, you deal with aunties and uncles. How do we navigate the field? How do we know which one to approach?
Right. So for the comment to the aunties and uncles, as long as they're mental health professionals, they can be involved. But no, we do need family for support as well. So I think that's a very key point to make. A lot of people do get confused between the various roles that, you know, mental health professionals work in. Just like when we're looking at physical issues, like whether we're looking at diabetes or cancer, there are specialists that work within those various fields as well. So, you know, first and foremost, anyone that's struggling with a mental health issue, they should ideally speak to their family doctor. That's usually the first line, first person to go to. And a doctor can perform an initial assessment. So they can also prescribe medications for things like depression and anxiety. But if they feel the need or see the need, they can refer for further evaluation to a psychiatrist. And so a psychiatrist is basically a medical doctor that's trained in psychiatry, okay? So that's trained in mental health issues. And a psychiatrist can perform assessments, they can diagnose, and they can also prescribe medications. So usually the person goes to a psychiatrist for maintenance and making sure that they're following medical compliance, they're, you know, taking the medication on time, they're taking the right dosage. If they need to increase the dosage or decrease or taper off, it's very important that they're working with a psychiatrist or their doctor.
Does a psychiatrist do counseling as such?
Well, a lot of psychiatrists, especially now, are trained in psychotherapy, so it depends on who you're going to. A lot of the times, many psychiatrists really, you know, help with the medical aspect of it and work with a psychotherapist or a psychologist to make sure that the psychotherapy is performed regularly. But more and more so, psychiatrists are being trained and are knowledgeable of the benefits of psychotherapy.
I was under the view that they only like, okay, so your problem is so, and they give you a prescription, but they don't get into actual counseling.
Right. I guess it would really depend on who you're seeing. As I said, there are some that are, and maybe there are some that are not trained in it. But you know, psychiatrists generally do ensure that the medical side is taken care of and that the client is taken care of.
When you say medical, you mean physiological or
Right.
the physical aspect?
Mainly, we're talking about medications, right? So they're the ones that do the diagnosis as well. So the big assessments that need to be done, and then the diagnosis. And based on that diagnosis, severity of symptoms and things like that, a psychiatrist is trained to prescribe medication and then monitor to see which dosage is correct, which medication is correct. And that's something that a person would do with their psychiatrist. They can always have one of the other professionals as part of their treatment, which I'll explain what they do. But the main goal of a psychiatrist is, yes, the medical aspect of the mental illness.
Please.
Okay. And so a psychologist can perform assessments and diagnosis, but they're not doctors, okay? So they don't prescribe. The only medical profession that can deal with the medication are the doctors. So the doctors and the psychiatrists. Psychologist, a social worker, and a psychotherapist, like a registered psychotherapist, provides psychotherapy. So what that is working with your thoughts, working with your emotions, working with your behaviors that are symptoms of your illness, and to help you to come out with better mental health outcomes. Okay? And so a lot of the times as a psychotherapist, I'm working to help clients understand their mental health illness, so doing a psycho education around the mental health issue. We're working with how to manage stress. We're working with how to create this work-life balance, learn new skills to deal with the stressors, helping to repair relationships. Because as I mentioned earlier, that a lot of times, you know, when mental health is not taken care of, they can be ruptured to relationships, right? And so helping in that. We also work with past trauma. So maybe someone's been through a trauma that's affecting their life currently, and so we work with that as well. And so basically the goals of a psychologist and a social worker and a psychotherapist would be to help the person reach their goals, right, in order to live an optimal life. And many times we can work with a doctor to make sure that the person is getting the medical side taken care of, as well as, you know, the behavioral component of the treatment.
So there's overlaps between the psychotherapist, psychologist, and social worker.
Right. There's definitely overlaps, except that a social worker and a psychotherapist are not doing diagnosis or the assessments for diagnosis unless they're trained to just do assessments. But we don't diagnose. We work with the diagnosis that, let's say, a doctor, a psychiatrist, or a psychologist has given us. So if I get, you know, a diagnosis of depression, now as a psychotherapist, I know what to do with that client. I work with that client to figure out what are the causes, how can we help, what are the things that we need to do in order to help them cope with that diagnosis.
So the gateway towards counseling would be the psychiatrist. Well, the family doctor, psychiatrist, who may refer you to one of the other.
That's one route. Yeah. You can go to your doctor. Many of the times now there are, like, you know, cedar wave therapy, for instance. You can call and book an appointment. And for example,
you don't need a referral.
You don't need a referral to book an appointment with a psychotherapist or a social worker or a psychologist. You need a referral to see a psychiatrist. Okay, because they're a medical doctor. So if a client comes to me and is, let's say, very depressed, showing symptoms of depression, I can then refer them to their doctor for further assessment, but I can continue to work with the depression.
So it's a two-way conduit to getting the services of a psychotherapist or social worker or psychologist.
Yes.
And just for the sake of our educational purposes, how are they OHIP covered or non-OHIP covered for the services of any one of these professions?
Yeah, so a doctor and a psychiatrist are OHIP covered, and it all depends on the route. So for example, sometimes if you are seeing a psychiatrist and they refer you to a clinical social worker within the hospital setting, it can be OHIP covered. Most of the times if you're just seeing a psychotherapist and you're not coming through, you don't have any psychiatry or doctor following you up, then it's not OHIP covered. Many people have insurance coverages through their workplaces, and so it can be covered through your workplace insurance. Okay. Yeah.
That's a necessary,
yes,
because it's not only fi sabilillah, you know, professionals do have to earn a living based on you know, whatever professions they've chosen to adopt. Is it necessary for a Muslim to seek assistance from a psychotherapist, psychiatrist who has knowledge of Islam?
Right. And I think that's an important question, right? Any good mental health professional will know their boundaries within their clients' or their patients' religious beliefs, okay? So it's very important for you to seek somebody that, even if they're not knowledgeable, they're aware of that, and so they can collaborate with somebody within the same religion to give you the best type of care. I do have clients that come to me, for instance, that are not of the Muslim faith, but if they adhere to their beliefs, I would have to understand where they're coming from and what would help them, right? So for a Muslim who wants to already be with somebody that understands their worldview, where they don't want to explain it too much, then a Muslim trained professional can be a good option. But most social workers and psychotherapists were trained to know those boundaries and to work with other people that can help our client with their religious beliefs.
From my point of view, it just makes it an easier transition.
Yes.
If somebody understands your belief systems and understands, how you relate to the world, your
Right.
worldview, so to speak.
Yes.
But it's not a prohibition for you to seek assistance from someone who specializes in the field, who is trained professional.
Exactly, and that's why you said the key word, trained professional,
Yeah.
right? Because professionals are trained not only in how to treat depression and anxiety, but also with the ethics of how to take care of somebody. So professionals will not cross the ethical boundaries, which is very important when we're working with mental health issues.
And each one of these professions are self-managed in the sense that they have codes of conduct and ethics and everything. You have an association of psychotherapists?
Yes, we are all regulated, so we're called regulated mental health professionals, where we have to seek training, we have to seek quality hours, we have to seek supervision and consultations, so we're constantly improving ourselves. We have to take ethics courses in jurisprudence, so this is why it's very important for anyone to seek help from a regulated professional, so there's accountability.
Yeah, because one of these things is that you become very vulnerable.
Yes.
When you sit on a sofa of one of these professionals. You're basically exposing your most innermost thoughts. What protections are there for confidentiality and that confidence that when you leave the room, your stuff is not also leaving the room?
Exactly, especially when we're talking about mental health in the community and we're talking about stigma and things like that. A lot of people don't want to reach out for help because we're a small community and maybe we know each other, but when you're trained and regulated, you're following your code of ethics, so it's 100% confidentiality. We do have something called breach of confidentiality, for example, if someone's going to harm themselves, but when it comes to community work, if someone's seeking to talk to me about their problems, then I'm not going to go leak out their problems to the next person that I meet at the masjid.
It's just going to cause more problems.
Exactly.
It definitely would not be helpful to the person's mental health.
Yeah.
So one has to be very guarded in how you approach people's information.
Yeah, and just to add to that, Brother Alim, you said about the worldview, a lot of clients that come to us because there's already an understanding of that worldview, right? They don't have to explain to us the obligations of religion or the obligations of their particular role in their family. It's already understood, and so that's one reason that a lot of people would prefer someone of their own faith background if they are practicing within their faith.
Yeah, let's switch it from faith to gender. Being of the masculine species, men don't cry. That's how we're trained.
Right. Well, men shouldn't cry. Men do cry, right? But you're trained to men don't cry.
Right. So we are very hesitant and resistant, and I'm making it personal because this is how I feel about it myself, to showing emotions, speaking up, asking for help. Or addressing mental health issues. How can these be normalized for men without damaging this sense of masculinity? Or being in control, or being the leader of a family, or not wanting to be vulnerable with those whom you have to protect?
Right. First of all, thank you for even making it personal, because when viewers see a male making it personal, they realize that they're allowed to do that as well. And I think that's one of the biggest problems, right? That even as men, because of whatever's been passed down, they don't feel comfortable talking about it. Oh, those emotions, not me, right?
I know it very well.
Right. And so when you said that, I'm making it personal about me, that's telling people, wait a minute, if he can, then maybe I can too, right? And so I think as we speak about mental health literacy, it's important to include that mental health care is just as important as physical health care, right? First of all, normalizing that, I don't know why, and we talked about the Islamic context. We are a religion of holisticness, right? Mind, body, soul. Yet we put so much emphasis on body, right? That we've kind of tucked the other things away. And so this is a problem really across all communities, where men are not given this space to talk about emotions and to normalize them. And so I think one of the first things to do is doing this, what you're doing today, essentially, to open up the spaces and the dialogue for men to hear it's normal to feel, right? It's normal that I cried, or it's normal that I felt hurt, or I felt sad. I think is key. The other thing is, I would say, to bring leaders in our community, like imams and scholars and male professionals, to talk about mental health within the context of men would be key. It's role modeling as well, right? If men can't see other men feel, then it's going to be abnormal for them to feel, right? Especially if this is what's been passed down within our culture. You know, personally, when I talk about this, as you can see, I keep going down to, without emotional health, there's really no physical or spiritual health. It all comes together, right? If I'm clinically depressed and I don't have the energy and the motivation to pray, right? And so it's very important to understand that emotional and mental health are part of the puzzle, right? And so the other thing is to decrease the stigma around this, to really talk about it, be open about it, and then to increase mental health literacy so people can start recognizing what mental health is. It's really emotions and behavior and thoughts, and can't we talk about those things, right?
Again, to be personal, I remember going to a happiness course, and the presenter asked, what makes you happy? And when it came my turn, I said, first of all, is there a me? Because I grew up as the eldest in a family of 10, and we were always taught about the good of the collective. You migrate to Canada and suddenly you're an individual.
Right.
There's individual rights, you know, there's plenty, so there's no economic hardship, so you don't have to sacrifice even the amount of food that you have at dinner,
Right.
Or whether you have dinner.
Yeah.
Because we come from societies where scarcity of goods and services and, you know, love is in abundance.
Right.
But in order for the collective to survive, the individual has to subsume themselves in the collective. Then you come into a culture where the opposite.
Yeah.
We have individual rights, we have freedoms to express ourselves. We have feelings.
Yes.
So that adjustment
Yeah.
is a really tough one to make.
Right.
And it's a generational thing as well. Because I see it in my kids. They aren't happy in the profession. They said, okay, I'm going to train to do something else.
Right.
Because their happiness is important to them.
Yes.
In my socializing, it's not about your happiness. Care to comment?
Yeah. I think that's so important, because a lot of our community comes from collective cultures, right? And when we think of collective cultures, I think there's so much strength in it as well. If you look at, you know, coming from back home, wherever we come from, it's not, when we talk about collective cultures, we also have to recognize the type of help we were getting as a collective culture, right? Where, you know, they say it takes a village to raise a child, right? Which is essentially so true in those communities, right? Where you have your grandparents, your aunts, your uncles, your sisters, your siblings, everyone's taking care of a child. So maybe the mental health burden is shared, right? When you come here, and when my parents immigrated, they were alone. They didn't have family here. So all of a sudden you move from this beautiful collective culture to this culture here that is also beautiful in its own way, but you're alone. And so now you're noticing what stress is and what taking care of your child is, and all these things that maybe didn't hit you as much over there are hitting you here. So I think it's very important to understand that, and to also understand that, you know, even if we're taking care of our communal rights, our collective, our family, isn't it upon us to take care of ourselves here, knowing that we are not in a village to take care of us, so that we can then take care of our family? Right?
And is it also not necessary to have a sense of community rebuilt?
Right. And this is why we're talking about mental health literacy, because the more we make this normalized and open, we can create communities to help our people that are alone. Because part of, one of the biggest risk factors is isolation, is being alone, that sense of isolation and hopelessness.
I have to carry this burden on my own.
Yes, which is here a very tough burden, isn't it? You can really be left alone and not know what to do. And so it's very important, when I first started this talk with you, is we're talking about how to help the individual, but also how to help our community, to build a community where we're safe and supportive for people who are having normal problems. Mental health issues are not abnormal problems.
Mm-hmm.
Right?
Then the environmental burdens is tremendous, and that's why, to me, it's necessary that you have, some sort of a network within the wider community.
Right.
That even just mere speaking to a friend, and you see that the immigrant experience is similar,
Right.
and the struggle is real, the similar struggles. You leave, all of that nice community and family
Yes.
behind, and now and they have expectations of you as well.
Right.
So it's really a tough. Resettlement is a tough thing.
Absolutely.
And especially also as if you're violently removed from your environment. So you can imagine the so-called refugees, and I say
Right.
so-called because, they're humans. Don't
Yes.
put labels on them.
Right.
They've had some bad experiences.
And that's the risk factors we're talking about. When
Yeah.
you come from those zones, you are at higher risk because of what you've experienced, and then you come to a place that's individualistic. And now you've come from community to, what am I doing here? Right? There's nothing, it's harder, it's alone. What do I do? Where do I go?
And these are some of the, you either have the community or you go to the professionals to unburden yourself or to seek coping mechanisms.
Right. And any good professional will connect you back to the community. Right? So part of my work is, yes, I work with the individual, but a lot of my work has to do with how do I connect this individual back? But I need to connect them back to a community that exists, that is there, that is safe, that is open, because it doesn't make sense for me to connect my client to a community that is harmful, for instance, right? So this is why it's very important that we work in tandem, we work together to build this capacity.
And that we normalize mental health as an issue.
Right.
Please explain suicide.
Yes. So this one is usually a tough one because it's not really talked about, right? And so suicide really means the act of ending your own life. Right? And so it's a way for people to escape pain or suffering. Many people who think about suicide are experiencing an intense sense of hopelessness. And we're just talking about that isolation and no community, right? And so unfortunately it is very common, but it's also very hidden because of the blame and the shame to the individual or the family. And so a lot of people really don't find out about suicide and suicide attempts. And just like, we're talking about the importance of having communities where we create these safe spaces for people that are suffering. And tying it into this conversation about mental health literacy, the more we talk about mental health and encourage help seeking, the better we will be at helping someone who's contemplating suicidal thoughts, okay, the act of suicide. They may not know what else to do. Right? They may have a mental health illness and need immediate support. They may have an undiagnosed mental health illness, and because of stigma and blame, they haven't gone to the right person for help. And so here they're crossed between, I don't know what to do here, and this looks like the only viable option, right? And so many of the times they're not going for the help because of that fear of shame, of blame, of stigma. And so they're not recognizing their symptoms, other people are not recognizing their symptoms, they're ignoring warning signs, and they get to this place of desperate hopelessness. Okay? If only we know, we can help, right? If I'm ignoring signs, I can't help you, right? And when a person is gotten to that level, they need intervention for somebody to recognize where they're at so that they can be the helping person. And so, yeah, I think creating the safe space where someone's able to seek out support. And now, mashallah, in our Muslim community, we do have organizations that are working to educate on mental health, that have distress lines. We have medical doctors, medical professions that can help somebody who's gotten to that level.
We are fast approaching out of time. Can you just give us some, how do we become mentally strong? Just some tips.
Okay.
So we can wrap it up.
My go-to tips are always be open to learning, right? Take classes, workshops, courses, things that you enjoy. Do things that you value that align with your core beliefs, so your friendships, your family, your religion. Find what your strengths are. Are you creative? Are you a leader? Do you have justice, qualities, love of learning? Do things that are valued to you. Holistic view of life, taking care of mind, body, soul, healthy connections, making sure that you're always seeking to learn, to connect with people. And I think, those are probably my go-to tips in order to be mentally strong.
Thank you very much. It's been very informative. And viewers, we were discussing mental illness, mental health. Please take care of yours. Be kind. We are humankind. So be kind as human beings. You never know what someone is going through. Just be kind. Peace out.
Not in my name, not in